You are doing everything right. You identified a health issue, consulted a professional, and started a treatment plan that fixed the physical problem. But lately, getting out of bed feels heavier, and your mood has dropped without a clear cause. Pharmacist Dr. Ethan Melillo points to a massive blind spot in modern medicine. 4 incredibly common substances found in standard medicine cabinets are scientifically linked to exacerbating depression. We can evaluate these using a quadrant chart. On the horizontal axis, we measure the physical relief a drug provides. On the vertical axis, we calculate the hidden toll it exacts on your psychological baseline. This audit covers 4 specific culprits: the ADHD medication Strattera, beta blockers like propranolol, oral contraceptives, and alcohol. We are going to run a strict, objective audit on the neurological return on investment for the substances currently in your system. Human biology is an interconnected ecosystem. Introducing a chemical to suppress a symptom in one area inevitably creates ripple effects in another. Effectively managing blood pressure or cognitive brain fog often carries a direct biological tax on your daily mood. A sudden depressive episode is frequently a predictable biological reaction to a treatment plan, rather than a personal failing or a lack of resilience. Strattera is often the first choice for improving executive function without the jittery highs associated with traditional ADHD stimulants. It functions by specifically altering the way your brain processes norepinephrine, the neurotransmitter responsible for attention and reaction time. However, manipulating this specific chemical carries a risk. In individuals with a history of mood instability, altering norepinephrine can severely flatten your emotional range or actively worsen depression. Achieving cognitive focus is a hollow victory if the medication neutralizes your capacity to experience joy once you finish your work. Propranolol is a beta blocker frequently used to eliminate the physical symptoms of panic, such as stage fright and a racing heart. Propranolol does not stay confined to the cardiovascular system. It readily crosses the blood-brain barrier to enter the central nervous system. Once inside the brain, it can trigger central nervous system depression, manifesting as chronic lethargy and a persistently low mood. Our matrix shows the trade-off: physical calm for the cost of nervous system depression. Swapping an acute spike of panic for a chronic depressive state is a poor bargain for long-term mental health. Oral contraceptives are highly effective for family planning and cycle control, making them one of the most routine medications in use today. These prescriptions introduce synthetic progestins to override the body's natural hormonal cycles. These specific artificial hormones can interfere with the brain's production of serotonin, the primary chemical responsible for mood stabilization. We plot reproductive regulation against the direct risk of serotonin disruption. Managing reproductive health should not require sacrificing the brain's baseline mood-stabilizing chemicals. Alcohol is the most accessible central nervous system relaxant, often used to cope with stress or social anxiety. That immediate relaxation comes with a biological cost. Processing alcohol severely depletes your brain's dopamine reserves. Once the alcohol leaves your system, your brain overcorrects, triggering rebound anxiety and dragging your mood significantly below your normal baseline. The completed matrix shows that short-term social relief leads directly to dopamine depletion. Using alcohol to borrow peace from tomorrow guarantees a deeper chemical depression today. We can now apply this framework to your own health profile. Start the audit with a simple question. Are you experiencing an unexplained mood drop? If so, check the timeline. Symptoms often emerge within 60 days of starting a new medication. If the timing aligns, you need empirical data. Implement a daily mood tracking protocol. Log the exact time you take your medication, then score your mood and energy on a scale of 1 to 10 2 hours later. Consistent tracking translates subjective feelings into a hard, objective dataset. A spreadsheet showing a sharp mood decline tied to a specific dosage schedule is far more effective at commanding a doctor's attention than vague emotional complaints. If you have a history of depression, discuss alternative formulations with your doctor or pharmacist before starting one of these prescriptions. You must never abruptly discontinue a cardiovascular or psychiatric medication with direct medical supervision, as doing so can trigger a health emergency. Use your tracking data to negotiate a treatment plan that better fits your specific neurochemistry. Health optimization requires a medicine cabinet that works with your brain rather than fighting against it.